This is my presentation on Crohn's disease. So what is Crohn's disease? Crohn's disease is a chronic type of inflammatory bowel disease that is known for the swelling of tissues in the digestive tract. This can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. It commonly affects the small intestine, however, it can spread to the deeper layers of the bowel. The cause of the disease is unknown, however, it's thought that the immune system may be a cause of it, that there may be a bacterium or a virus that triggers Crohn's disease, or there is a genetic tendency or a genetic inheritance to getting the disease, as it is more likely to develop in someone who also has a family member who shares the disease. There's no known cure for Crohn's, but there are therapies that can decrease any signs and symptoms greatly, as well as potentially bringing long-term remission and healing of the inflammation in the bowels. It most commonly affects people between 20 and 30 years of age. However, it can happen at any age. And it is fairly common, with more than 500,000 people having Crohn's, and it's becoming more common and more frequent over time. However, the reason for this spread is unknown as well. So common signs and symptoms of Crohn's disease includes chronic diarrhea, fever, fatigue, abdominal pain and cramping, bloody stools, mouth sores, decreased appetite, weight loss, and patients may also have pain or drainage around the anus or near the anus due to fistulas or tunnels in the intestinal wall. While symptoms can vary from person to person, the type of Crohn's a person has can impact the signs and symptoms, as well as any complications that they may experience. So the first type of Crohn's is ileocolitis. This is the most common type, and it mainly affects the end of the small intestine and colon. The symptoms associated with this type of Crohn's disease includes diarrhea and cramping, pain in the middle or right lower abdomen, and significant weight loss. The next type is ileitis. This only affects the ileum, and the symptoms are the same as ileocolitis. There's also gastroduodenal Crohn's, and this affects the stomach and the beginning of the small intestine, and this is associated with nausea and vomiting, lack of an appetite, as well as weight loss. There's also, and I'm going to completely butcher this, jejunolitis, and that's patchy areas of inflammation that are located in the upper half of the small intestine. And then finally there is Crohn's colitis, and this only affects the colon. Crohn's can impact other areas of the GI system. It can thicken the intestinal wall, which can narrow the intestines. This can form partial or complete blockages in the intestinal tract. Fistulas are also common, and this is where the inflammation goes through the intestinal wall, which makes tunnels. These abnormal pathways can become infected, which will lead to the next complication, which is abscesses. And these are pus-filled pockets of infection that are located within the intestinal wall. There can also be anal fissures, ulcers, and malnutrition. And finally, there can also be an increase in the inflammation that's found in other parts of the body, such as the joints, the eyes, and the skin. So there may be some factors that can play into the likelihood of developing Crohn's. This can include age, ethnicity, family history, cigarette smoking, and NSAID use. So while Crohn's can occur at any age, people are more likely to develop the disease in their 20s or even sometimes younger. And while anyone in any ethnic group can develop Crohn's, it is more common in white populations as they have the highest risk, especially those with an Eastern European Jewish descent. Family history can also increase your risk of developing Crohn's, especially if another person in your family is a first-degree relative, which is like a parent. And many, as in 1 to 5 people, have a family member that also has Crohn's. And then finally, non-steroid anti-inflammatory medications, also known as NSAIDs. They don't cause Crohn's, however, excessive use can increase inflammation in the bowel, and that can make the symptoms worse, as well as simply smoking. In order to diagnose Crohn's, the doctor may perform a blood test as well as a stool test to kind of rule out other causes of the diarrhea and other associated symptoms. There may also be a colonoscopy performed where the inflammation of the bowel is tested, as well as a CT scan. And finally, they can perform an upper GI exam or an endoscopy. I always trip over that word, to further test the inflammation. So while there is no cure for Crohn's, there are things that can be done that reduce the symptoms of this disorder. This includes antibiotics to fight against infections associated with the abscesses or fistulas, antidiarrheal medications, biologic or immunomodulator medications that suppress the immune system, bowel rest by giving nutrition through parenteral ways such as tube feedings, and you can also give corticosteroids to decrease any inflammation within the bowel or the stomach, depending on the type of Crohn's that you have. And finally, surgery can be performed for any blockages, removal of parts of the intestine, etc. So as a review, we went over what exactly Crohn's is, what the cause of it is, or if there was a cause, some signs and symptoms, the different types of Crohn's, complications associated with it, some risk factors for the disease, as well as treatment options. And these are my sources. Thank you for listening to my presentation.